We've been here for 4 years providing our service, but this is a purpose-built clinic for us to use, and it's fantastic. It's very exciting. To me, it shows how far we've come, that the university is investing in our program now and providing us with this beautiful space to work from. This building will be staffed by a range of health professionals who will provide free services to children and families in this community. So students come here on a prac from a range of courses from the Faculty of Health Sciences, and they work together to provide this high quality interprofessional service to the children here.
It's entirely responsive to the needs of the children. So as their needs change, so does the program, which makes it an authentic learning experience for the Kirkin students and of immediate relevance to the children of Chalice.
Oh, it's really, really good. The interprofessional team is really amazing, just having to work with the other students.
They love the opportunity to work with each other and learn from each other as well. For example, some occupational therapy students come here, they have no idea what a speech pathologist does or a nutritionist does, a dietitian, but here they learn about each other's profession, and they find that so interesting, and it gives them the skills to be able to not only provide a holistic service to the children, but refer to one another with more confidence once they graduate.
What I was really looking forward to is just working with a lot of other health professionals that specialise in their fields, just to give like a more holistic approach to how we treat children and interacting with children so that they're getting more out of their therapy sessions.
I'm expecting to develop my skills as a community health nurse, learn some communication skills with children, and also a bit of paediatric work, so with the babies in the healthcare centre.
When they come, many of our students, they haven't worked with children before. Maybe they're not an auntie or an uncle yet either, and they don't have children of their own, so it's quite daunting for them to come and be expected to provide this paediatric service. And so a lot of learning occurs along the way, a lot of tweaking has to happen, and that's okay because that's real, They're not expected to have all the answers straight away.
I'm hoping to get a bit of a better understanding of how the multidisciplinary type of team works, because obviously patients need a lot of the time more input from other professions. So although it's great being a physio and learning all about what I do, it's also essential to their care that I know about what to look for and how they play a role in my patients' care.
The range of services includes speech pathology, occupational therapy, physiotherapy, nursing, social work, psychology, and exercise and sports science. So all of those students from those professions come here, they work together to provide this holistic service to the children and their families.
Working with a physiotherapist to work on a goal that would not have been able, which you wouldn't have been able to succeed had they not been there. So I think I realised how important it is to work as a team here at Chalice, and I really do take on the skills I learned as a team member to all my other pracs.
I'm just looking to learn more about what all the other professions do, because I'm graduating at the end of the year. It's really important that I know how what they do affects my own practice and whether I need to refer kids on or look for different services. So it's just sort of consolidating all that knowledge we've already sort of learnt throughout the other 3 years of our degree.
Because I get to learn skills off them and I get to teach them my skills in my profession or my area.
It's my first prac where I've actually worked alongside other students in other professions, so it is a really good opportunity to be able to learn before I graduate about other roles that the multidisciplinary team or other professions will have.
And we can target our goals while also enhancing other people's goals, so other health professionals such as speech pathologists and occupational therapists.
You get a lot more experience to sort of consolidate your skills across a range of children, and you really understand a lot more in depth what all the other professions do, because you can actually see what they're doing on a daily basis, how it affects them sort of in a real-time situation rather than doing something across the internet where it's not quite so hands-on.
Always going to be a valuable attribute if you can work alongside another team member and cooperate and know exactly what to help to look for and what. It's also good with learning jargon. Sometimes you get confused with other professions' terms, so when you're working alongside them or on prac like I am now, you get more familiar with their terms and a better understanding, which is good.
What I would say to people coming here to do a placement at Chalice is keep an open mind and have fun. There's no other way of working with kids apart from making your sessions fun and trying to integrate everything you know in a way that you both will enjoy.
I feel it does make our students more employable because the future health workforce needs to be working in this interprofessional way. And what better a platform to gain those skills than right here at Chalice?
So I think it's just going to make me a much better professional, just because I'll have a lot of input from other areas so that I can also communicate with other people, and then I think anybody that comes to us, patients, will have a better understanding that it's not just one avenue of health, it needs to be a whole approach.
7 weeks is more experience than any other OT who hasn't had a prac in this place. So I hope the experience that I got here will definitely make me more employable in the future.
It's just something that you can't get any other way, and I think it's such a valuable opportunity that they give us to allow us to get here and practice it before we go out in the workplace, because it is such a big aspect of what we will do once we've graduated.
Of course, you need practical experience, especially as a nurse. You need to, engage, and you need to know how to talk, communicate, all these things. So all these skills need to be practiced.
These students are ready to hit the ground once they leave. I have confidence in that because they're doing it here. They have to do it here. They get to experience the whole process of providing healthcare to children, from identifying the need and assessing the children, speaking with the families, etc., right through to planning the service, implementing it, and then evaluating it, because they're here for quite a long length of time. So here at Chalice, the placement is self-directed. So the students are part of all of that. The students are the service. They're not shadowing other health professionals or observing others operate. They are the service. So to me, that's the epitome of work integrated learning.
It's quite different, being in a community health setting rather than the usual hospital setting. So it's a good experience.
And also when I do go out into clinical placements, so actual more hands-on skills, but it helps across the lifespan working with children.
So the partnership that we have with Curtin provides immediate access to much needed services that are responsive to the needs of the children at our school.
I love kids, so it would really help me with paediatric nursing in the future, hopefully. So it's a really good start. Community placement is
Within your community, that's what we're based on, health prevention and promotion. So
whether it be with children or adults, this experience just is unbelievable because you get to work hand in hand with another profession, so like occupational therapy or speech pathology, and you get to get a bit of a better understanding and learn off of them about what they're looking for and how you can apply that to a bit more of a holistic approach with treating people. So even though it's with children now, it could be with adults later that I'll have a better understanding and be able to treat them to the best of my ability.
With this partnership, our children benefit by receiving the services that they require, and the benefit for the Curtin students is that they get to experience some authentic learning in a safe and supportive learning environment in an integrated manner because they're working with other health professionals. So the benefits are enormous, but they're mutual.
It was amazing. Working at Chalice was such a life-changing moment for me, if you could say. It gave me the chance to show my passion for working with kids, but also help them out in their daily lives in a way that I never would have been able to.
It's fabulous. I've never seen anything like this, and just to have a school run this way is brilliant. To interact, we obviously get to interact quite a bit, but actually working as a team is a rare experience. So yeah, Chalice is doing a very good job at making that more of the forefront of how our future health should go.
Yeah, and as a student, that must be quite a unique opportunity. People that are unis don't have this.
Yeah, no, absolutely. Yeah, it's brilliant because we see each other pass by in the corridors, but we don't really speak. And then here you understand that, oh wow, they do this, and it's quite similar to us, but it's more specific. So yeah, brilliant as a student. So we're getting ahead of the game a little bit. So
it's definitely a good feeling when you see a child who needs your help, and you do the best you can and you see them improve. And I feel the hard work that went into this and the fun that went into this will definitely carry on with me when I graduate.
It's really good, really, really enjoyable, but it helps. It's like amazing to find out exactly what a speech pathologist or an OT or a nurse, like what role they have in that child's treatment. So yeah, it's really, really good. The children are so happy all the time. It's great to work with them.
I'm very confident that the students who do a placement here are ready to hit the ground running once they leave because they have been providing the service here. So in my mind, they're more employable because they are able to link that theory with practice, and they're able to work in this interprofessional way. And that's what the future health workforce wants. That's what we need.